what if this pandemic was far worse? What if the survival rate was something like 70%, meaning 30%, 3 out of 10 people are dying from this? Then I could see them having this sense of urgency. But the sense of urgency is out of kilter. Not when you have 99+% of people getting this being completely fine. I mean, it's significantly higher than 99%. The young, especially under the age of 50, pretty much 99.997%, you're going to survive this. So why are we going to all these measures with something that's so risky? And then it's so risky, but you're not going to give people a chance to have compensation if something happens? It just doesn't seem right, does it? I have another article here from masslive.com that's down the same lines about facing bureaucratic black hole in Washington, D.C. The Countermeasures Injury Compensation Program, the CICP, has just 4 employees. So this is the group that's supposedly going to take care of the V-word problems for 9/1 DIVOC. 4 people. Decisions are made in secret. Government officials are the ones that do it, and they do it in secret. Claimants cannot appeal to any judge, and payments in death cases can be no higher, I don't know where they come up with this number, no higher than $370,376. That's the most they can get. And so they've paid fewer than 1 in 10 claims over the 15-year history. So this is the one that's been around for a while. Fewer than 1 in 10 claims, less than 10%. V-words historically provide broad protection with little risk, but come with side effects like any other drug. Few unexpected adverse effects have been reported in the early days, But experts are concerned that with the sheer volume of people expected to get this V-word in the U.S., even a successful rollout with relatively few ill effects could swamp the program. Again, even if we're looking at 1% of the population, and let's just say 200 million people of the 330 million in America, that's still a lot of people that would be injured for a 4-person office. We would definitely need to ramp up the office. We would get overwhelmed very quickly. A spokesperson for the Health Resources and Services Administration that oversees the program says that it's planning to process the potential influx of 9/1 DIVOC claims. Additional staff will be hired as needed. Unlike the more established federal V-word court, which decides cases of injury from childhood V-words and other common inoculations, the Countermeasures Injury Compensation Program, remember CICP, was created by a 2005 law specifically dealing with V-words developed under the Emergency Use Authorization, which is what we're under with 9/1 DIVOC. The idea was to allow the pharmaceutical companies and government entities the freedom to develop and distribute these V-words to meet the urgent public health needs without the threat of being overrun with expensive liability lawsuits. Under the program, drug makers can only be sued for what's called willful misconduct. Have they not already created willful misconduct? I did a recent Jimmy Rants a couple weeks ago on an ingredient that they're putting in these V-words that specifically we know have adverse reactions in people. It's a known toxin, and it's known to develop autoimmune disease in a lot of people. It's known for that. So would that be considered willful misconduct to put an ingredient in there, which apparently is a key ingredient to making these mRNA V-words work, but it's a known toxin, a known reactivity that leads to autoimmunity. Is that willful misconduct? I think it is. I think it is. Several senators objected at the time that this passed, including the late Massachusetts Democrat Edward Kennedy, calling it a Christmas present to the drug industry and a bag of coal to everyday Americans. The vast majority of the claims under the program stemmed from the swine flu vaccine a decade ago. The low number of people awarded money, just 29 people were awarded money out of 499 people that filed a claim. Reflects its design. Most claims have to be filed within a year, regardless of when the side effects show up. The program does not pay for lawyers, doesn't pay for any expert witnesses. It provides little opportunity for those filing claims to participate. The awards do not pay for pain and suffering. It's illusionary, according to a vword lawyer. No one is going to actually get any compensation from that program. By contrast, if you go to V Court, it allows for claims within 3 years, pays for lawyers, pays for witnesses, grants awards for pain and suffering, and it will permit you to appeal it all the way to the Supreme Court of the United States. The difference is reflected not only in the number of awards, but in the size of the awards. The countermeasures program has already paid out $6 million for an average award of about $200,000 a claim. And you might think, okay, that's good. But the vword court has not only paid out 7 of 10 cases, 70%. Remember the other one, less than 10%. The court, 70+% of the cases are awarded damages. And its average claim, $570,000, more than 2.5 times larger. And it's $4.4 billion paid out over the past 3 decades. So it's a great argument for the anti-V-word people to say, oh my God, this is dangerous. If something happens to you, the program is going to turn their back on you. They said it would be helpful to know specifically why the claim is approved or rejected in the program. It doesn't release even the most basic details, such as the kind of sickness that people claim that they got. So if you do a Freedom of Information Act trying to find out why something was denied, you won't be able to find out what the people were claiming. One of the biggest reasons for rejection is that 1-year filing deadline. She recalled receiving dozens of calls. This is a lawyer that deals with V-words. She recalled receiving dozens of calls from people saying they'd been sickened by the V-word for H1N1 a decade ago, some complaining of possible symptoms of Guillain-Barré syndrome, a rare autoimmune or immune system disorder that results in paralysis and death. It was just too late. There was nothing you could do. That was the case for another lady in Pennsylvania who filed a claim about a year after learning about her mother's V-word had triggered this syndrome in her and killed her. The clock started ticking, but she didn't show any symptoms. I didn't know what was happening to her. She started racking up tens of thousands of dollars in hospital bills. She was crawling down a hallway, her legs limp. A few days later, she died. I didn't know a V-word could do that. Think about all those people going to be taking this 9-1 DIVOC V-word, and they'll have no idea that a V-word can do that, whatever that is. No one is sure just how many of the more than 200 million Americans who are expected to receive these V-words are likely to develop severe side effects, and not everyone who does will file a claim. Only 1 in a million people who got the measles, mumps, and rubella V-words first administered 50 years ago suffered severe reactions, but other V-words had higher ratios. Using the 25 per million who suffered severe side effects from the H1N1 V-word, for example, that would put the number of such cases from the coronavirus V-words at over 5,000. That's more than 10 times the countermeasures program has ever received in its entire history. One solution is to shift coronavirus claims to the V-word court, formerly known as National V-word Injury Compensation Program, but that court itself is trying to work through a backlog of cases. It has 8 judges currently taking more than 5 years to resolve any claim. Another problem with this is funding. Unlike claims in V-word court, which is financed from a 75-cent excise tax on every V-word shot, the countermeasures program relies on Congress for its budget. A $30 billion allocation by Congress to buy V-words and finance other efforts to fight the coronavirus allows some of that money to be transferred to a fund to help pay claims, but none has gone over yet. See, here's the thing, these pharmaceutical companies are going to be making a killing off of this V word. I mean, billions, probably tens of billions of dollars. Can they not be required to have to pay into a fund that's like an escrow account for people that have these injuries? Like, I'm not understanding why they can develop a V word, they can be not sued, but not have any liability whatsoever, no culpability financially that they have to pony up some money, and yet they're going to reap in all these tens of billions, maybe even hundreds of billions of dollars in profits from selling this V word. To me, it's unethical. They're making any grand profit at all. Okay, recompensate for the research and development. Make enough to make a living, but to have these billions of dollars, tens of billions of dollars that they're going to potentially have from this V word in the midst of a global pandemic, to me is unethical. And they definitely should set aside some of that money to be there for people who are going to be victims of 9/1 DIVOC and the V word. They are. All right, I have one more article, and this one has some really interesting questions, all about the Pfizer and Moderna 9/1 DIVOC V words, as more and more people are having allergic reactions. And they talk about that specific ingredient that I did the Jimmy Rants on not that long ago, polyethylene glycol, PEG. Remember that? I did the Jimmy Rants recently about this. And so this article is from the Children's Health Defense.org website. And so the Children's Health Defense have been trying to warn the Food and Drug Administration, the FDA, as well as Dr. Anthony Fauci, about the potential problems with anaphylactic reactions. And so they had a list of 5 questions they wanted to ask Dr. Fauci and the FDA. And it gets to the heart of what will they do about these people who have injuries from these V words. First question: why didn't the FDA's Center for Biological Evaluation and Research require Moderna and Pfizer to conduct immunogenicity testing on their V words for anti-drug antibodies as recommended in their own agency's guidelines for drug development during the clinical trials? So in their guidelines, which are titled Immunogenicity Testing of Therapeutic Protein Products, which is what this V word is, developing and validating assays for anti-drug antibody detection, guidance for industry. So in there, they're supposed to test for immune responses to the therapeutic protein products that have the potential to affect the pharmacokinetics, pharmacodynamic safety, and efficacy. They were supposed to do that. The clinical effects of immune responses in those subjects that are highly variable, ranging from no measurable effect to extremely harmful. In other words, the same V word reacts differently in different people. And it's because of that polyethylene glycol. That's part of the thing. Detection and analysis of the anti-drug antibody formation is a helpful tool in understanding potential immune responses. Information on immune responses observed during the clinical trials, particularly the incident of this induction and any other application of the responses about this. Accordingly, such information, if applicable, should be included in the prescribing information as a subsection of the adverse reaction section called immunogenicity. However, despite the FDA's own guidance recommending that information about this to be included on the packaging for the V word, no such information is included on either the Pfizer or the Moderna 9/1 DIVOC V word inserts. In other words, if you go to see somebody to administer the V word to you, usually you go to the doctor and they give you a prescription. They give you a big sheet of paper. It's got all the everything about that drug. Not with 9/1 DIVOC V word. Page 6 of the FDA document cites research that specifically addresses the need to adequately understand the risk of anti-drug antibodies in products with modifications such as pegylation, but without that information provided on the insert, vword recipients just don't know that they are at risk.